Before that, allow me to read a brief introduction about Dr. Zulfi. Dr. Zulfi Nur Amrina Rosyada, Sarjana Peternakan Master of Science, Lecturer Staff of Animal Husbandry Division, Faculty of Veterinary Medicine, Universitas Erlangga. For her educational background, she had her bachelor's degree in Animal Science, Gadjah Mada University, Sarjana Peternakan, her master degrees in Reproductive Biology, SVMBS, IPB University, Master of Science, doctoral degree in Reproductive Biology, SVMBS, IPB University, Doctor, postdoctoral of Research, Center for Applied Zoology in National Research and Innovation Agency, BRIN, in 2023. Her achievement in academic activities are 12 publications peer-reviewed, current H-Index Scopus 4, H-Index Google Scholar 5. Please welcome Dr. Zulfi Nur Amrina Rosyada.
Thank you, Graciela. Good morning, everyone, and also good evening, Professor James. Welcome to today's guest lecture on transition cow nutrition from dry period to early lactation. This session is hosted by Animal Husbandry Division, Faculty of Veterinary Medicine, Universitas Airlangga. And I'm Zulfi, honored to serve as your moderator for this insightful session. Before we proceed to the presentation, I would like to take a moment to warmly welcome our esteemed speaker, Professor Dr. James Drackley. Good evening, Professor Drackley. How are you today?
I'm good, thank you.
Okay, thank you, Professor. It's great to have you here with us today, and we're excited to learn from your vast expertise in dairy cattle nutrition and management. But before we begin and dive into this critical discussion, let us first watch a brief video introduction of our esteemed speakers. Professor Dr. James Trackley, Professor Emeritus of Animal Sciences at the University of Illinois, Urbana-Champaign, who is globally recognized for his groundbreaking research in dairy cattle nutrition and management.
Professor James K. Drackley, Emeritus Professor, University of Illinois, Urbana-Champaign. Academic Excellence, Scopus, ID 70045044934, H Index 60, 12,078 citations, 241 publications. Academic background, PhD in Animal Sciences, Iowa State University, 1989. Master of Science in Animal Sciences, South Dakota State University, 1985. Bachelor of Science in Animal Sciences, South Dakota State University, 1981. Research focus, dairy cattle nutrition and health, transition periods of cows and calves. Professional highlights, author of The Development, Nutrition, and Management of the Young Calf, Iowa State University Press. Recognized as a Fellow, American Dairy Science Association, 2015. Honored with the Spitzenland Grant Professorial Career Excellence Award, 2022. Please welcome Professor James K. Drackley.
Thank you, and that's inspiring introduction to Professor Drackley's remarkable career. We're fortunate to have him with us today. Professor Drackley will share best practices for transition cow management, focusing on optimal nutrition during the dry period and early lactation. Without any further ado, I invite Professor Drackley to begin his presentation. The screen is yours, Professor Drackley.
Thank you very much. It's a pleasure to be with you this morning, your time, and this evening, my time. I'm going to share my screen here, except somebody else is sharing, so I need to, there we go. Okay, can you see my slides?
Yes, very well, Professor.
All right. Well, again, I'm pleased to be here for this guest lecture today, and we're going to discuss transition cow nutrition. The transition period is generally thought to be from about 3 weeks before calving to 3 weeks after calving, but the entire dry period is important in the transition adaptations, so we'll consider that. I'll start out with this diagram showing the gradual changes in nutrient intake and nutrient densities in the diet. So we have kilograms per day on the y-axis to the left and percentage to the right here. The black line shows dry matter intake as we go from the far off dry period to the close-up dry period, then to the fresh cow, and then finally to the high cow period, the high lactation period. The blue dashed line shows the percentage of NDF in the diet. And you see we start out quite high, close to 50% NDF during the dry period, and decrease down, of course, to less than 30% during peak lactation. Starch content, on the other hand, starts quite low in the far off dry period and then increases as we go into lactation. The amounts of starch and NDF consumed, however, show less change. If you look at the blue triangles here, that shows the NDF intake in kilograms per day, and you can see that it's generally fairly constant across these vastly different stages, while the intake of starch increases quite markedly from the far off dry period into the peak lactation period. So one of the goals of our transition period is to make these changes gradually so that the cow is able to successfully adapt to each different diet. Let's start with some basic best practices for the transition period. A hugely important factor is to maximize cow comfort. And this means that the cow needs to have comfortable resting space, adequate feed bunk space, and calm management to avoid excitement and stress on the animal. We're not going to talk about this in this lecture, but that is a hugely important part of the successful transition. Second is to calve cows at about a 3.0 body condition score on a 5-point scale. This is somewhat thinner than in previous years, but as we understand more about body condition score and its mobilization, we're realizing that a thinner body condition score than historical averages is best for the cows to make a smooth transition. We don't want to overfeed energy in the far off dry period. The close-up diet, if we're feeding one, should be intermediate to the far off diet and the fresh cow diet. We want to meet metabolizable protein requirements for the cow and prevent hypocalcemia by using anionic salts or a calcium binder. Finally, the newest item on the list here is to boost the immune system and control inflammation and oxidative stress. This is where the cutting edge of our study of the transition cow is at the moment. We're understanding the role of inflammation from an activated immune system, but we don't have very good means to control the effects of that inflammation and oxidative stress. We'll go through and talk about each of these or most of these in turn here during the presentation. This is something called the high fertility cycle that was put forward by Paul Fricke, Milo Wiltbank, and Richard Pursley, three very famous reproductive physiologists in the United States. And it starts with a calving at a relatively thin body condition score. Again, a body condition score in their recommendation of 2.75 to 3.0. Cows that calve at that body condition score lose less body condition, and as a consequence, they have fewer health issues. Because they're healthier, they have increased fertility, and it's easier to get the cows pregnant in an early stage, preferably by 130 days in milk. Cows that get pregnant again that quickly gain less body condition score over the remainder of the lactation, and so they return to the next dry period at that same body condition score of 2.75 to 3.0. This is a nice way to look at the concepts that we'll be talking today. I usually come into this in the close-up period talking about low body condition loss and fewer health issues, but it's nice to have this joined up with fertility, with the high fertility cycle concept. Adjusting body condition score over time is of course not something that's done quickly or easily. It's a long-term program. First of all, we need to increase reproductive success. In our country, we use synchronization protocols quite widely now, aiming to have the cows pregnant by 130 days of milk. We want to maintain dietary metabolizable protein supply during mid to late lactation to help partition nutrients to milk rather than body tissue, body condition gain. We're going to use a controlled energy program in the drier transition period, and we'll talk about that tonight, this morning. Improving fresh cow management so that cows get off to a good start. And finally, culling long interval cows or long dry period cows and cows with chronic reproductive problems that tend to be the heavy cows, the fat cows in our herd. So we'll start on the nutrition side with considering energy. And the basic concept that I want to address as what we think is the ideal approach is not too much, not too little, but just right. We want cows to consume around 100% of their requirements with a typical range in the field of 90 to 110% of their requirements consistently and with all the other nutrients adequate. And we'll talk about what the requirements are here in just a few minutes. So the controlled energy program has sometimes been called the Goldilocks program because of the similarity of not too much, not too little, but just right. We're going to use bulky, low energy forages to control the ration energy density and total dry matter intake so that we meet but not exceed the energy requirements for the cow. We need this to work well. We need to have a balanced TMR, lower in energy but adequate in metabolizable protein and other nutrients. And we're going to use things like cereal straws to dilute the energy density of corn silage and other high energy byproduct feeds. So the concept of a TMR, this is not a controlled energy diet because it's just some poor quality hay available for the cows. We have no way to control the nutrient intake to ensure that the cows are consuming adequate amounts of nutrients or avoiding any excesses of nutrients. So again, a TMR is the best working situation. Some of the key effects of controlling energy intake in the dry period were discussed and published by my colleague Phil Cardoso during his PhD work. Decreased risk of displaced abomasum by 5 times, decreased risk of ketosis by 2 times, decreased median days to pregnancy by about 10 days, and all these advantages with no difference in milk yield or composition. The controlled energy diet increases the mass of rumen contents. This was an experiment done by my former graduate student, Bruce Richards, where he actually dumped or removed the contents of the of the rumen through a rumen cannula and measured them and sampled the contents. So the charts show the mass of rumen contents in kilograms for cows that were fed a high straw controlled energy type diet in the blue bar, and cows fed a more energy dense diet in the orange bar. And you can see there was significantly greater amount or mass of rumen contents in the cows that were fed the high straw controlled energy diet. And also the same was true when we look at it as a percentage of body weight. So this may be one of the reasons why the diets have been quite effective in eliminating displaced abomasum and maintaining the rumen environment across the calving transition. Excuse me, it went too far. This is an experiment that we did several years ago to look at the masses of internal body tissue, internal adipose tissues rather, when cows were fed a low energy, controlled energy type diet or a higher energy diet over an 8-week period. We use non-lactating, non-pregnant cows, so they're not strictly a true dry cow, but we believe the principles are the same. We randomized the cows by body condition score across the group of cows at the start of the experiment, so they were the same in body condition score. The final body condition score after 8 weeks was not different between the low energy and high energy, despite the fact that the high energy cows gained significantly more body weight. When we killed the cows and dissected them, there were massively increased amounts of fat in the omental site around the stomach, the mesenteric site around the intestines, and the kidney fat or perirenal fat, as well as other depots that are not shown here. So the mass of internal fat was increased by more than 75%. And these visceral adipose tissues are important because the blood supply from these tissue drains directly to the liver via the portal vein. These are the bad fat deposits in humans that we're worried about with obesity and type 2 diabetes. And we've shown many of the same mechanisms to be in place in cows that are overfed during the dry period. Now, nutrient intensity or nutrient density changes during the transition, as we said at the beginning of the presentation. We can diagram this schematically as shown here, where the nutrient intensity is moderately high in late lactation, drops quite sharply to the far off dry period, increases somewhat in the close-up dry period, and then increases again to the fresh cow diet if we have one, and then with a further increase to the high lactation group. But we don't want this to happen, where we don't decrease the energy density enough during the far off dry period and close-up dry period so that there's not as much of a change going into the fresh cow period. Preventing excessive energy in the far off dry period is, in my view, in our experience through research, the most important part of this whole puzzle. In two group systems, avoiding overfeeding in the far off dry period was more important to the transition success than was the close-up strategy. So we need to pay attention to what the far off dry cows are consuming. Here's data from an experiment conducted by another one of my PhD students, Heather Dan. And we had 3 different diets fed during the far off dry period. A high straw controlled energy type diet that was formulated to meet 100% of the cow's requirements. A higher energy diet was formulated to provide an excess of energy, 150% of the cow's requirements. And that same higher energy diet then fed at a restricted amount so that the cows could consume only 80% of their calculated energy requirement. What I've shown in the table are data from the fresh cow period, the first 10 days in milk, according to those 3 far-off dry period diets. Dry matter intake in the first 10 days postpartum was lower for the cows that were overfed during the dry period, the far-off dry period, and the energy intake was the lowest relative to the cow's requirements. Milk production tended to be greatest for the cows that were fed the controlled energy diet to meet their requirements. More recently, we've shown that the higher energy diets fed during the dry period are more inflammatory to cows, generate more of an inflammatory response. These are mRNA abundance figures for TNF alpha in the top panel and for interleukin 1 beta in the liver over the transition period. And you can see that for both of these inflammatory cytokines, the cows that were overfed in the dry period had persistently or chronically elevated concentrations of these pro-inflammatory cytokines, compared with cows that were fed to their requirements or slightly restricted. We also looked at the liver activity index, which is an index that has been developed by Giuseppe Bertoni and his colleagues at the University in Piacenza, Italy. And what the index is based on is the combined effects of cholesterol, albumin, and vitamin A in blood, because these represent acute phase proteins that are reduced or inhibited during inflammation. So a higher index number is less inflammatory. Here from the same experiment that I've been talking about is the liver activity indexes for the different dietary combinations. The highest or best liver activity index was with cows that were fed a controlled energy to meet their requirements, while the worst liver activity index, representing the most inflammation, was with cows that were overfed during the far-off dry period. In another assay, we used microarray data to look at gene expression in the liver during the transition period. And this is showing some transcripts that were upregulated by the high energy diet versus a controlled energy diet on day 10 of lactation. So the diets were fed during the dry period, and we're looking now at the carryover effects into the fresh cow period. Concentrations of the mRNA for haptoglobin and serum amyloid A, 2 of the acute phase proteins, were increased by the high energy feeding during the dry period. Mammary serum amyloid and another serum amyloid A2 also increased. So a general increase in acute phase proteins that we know are associated with inflammation in the cow. All right, so let's switch and look at the NA net energy of lactation concentration of diets for far-off dry cows. And this is a change in the new NASEM requirements relative to the previous NRC in 2001. So I've put together a fairly simple standard dry cow diet here, consisting of 40% of the dry matter is corn silage, 41% is wheat straw, corn gluten feed, soybean meal, canola meal, urea, and minerals and vitamins. This is for a typical far-off Holstein dry cow, 814 kilograms, 14 kilograms per day of dry matter intake. The NRC from 2001 would calculate the energy density of this diet to be 1.39 megacals per kilogram of dry matter. And the cow then would have a total intake of 19.5 megacals of net energy daily. The same diet plugged into the NASEM software would produce an NEL of 1.56 megacals per kilogram for a total energy intake of 21.8 megacals per day. So the net energy density predicted by the two systems is different, but the requirement side also changes. This is a summary of the energy requirements for cows from NRC 2001 and NASEM 2021. The big change is that NASEM has increased the maintenance requirement for cows. So we have almost a 4 megacal per day increase here in the maintenance requirement. And the NASEM committee increased maintenance requirements for all categories of cattle on the basis that as we're selecting for increased milk production, we've had an increase in the systems that support that lactation, and so the increase in energy requirement for maintenance. Pregnancy requirement in this stage is about the same in the two versions of the nutrient requirement system. So the total net energy required is about 3 megacals greater for when calculated in the NASEM system compared with the NRC system. This diet, let me go back here. No, I'll stay with this one. So if we calculate the balance, the requirement, the intake minus the requirement, they're both strongly positive for metabolizable energy and net energy, also for metabolizable protein, which I haven't talked about. Both of these are higher with the NASEM prediction, and then 2021. You have to use the net energy that's calculated by the NASEM system to be accurate. And this diet is not low enough in energy because we're still in substantial positive energy balance during the far-off dry period. So to address that, we can adjust the diet formulation, perhaps adding more wheat straw or taking out corn gluten feed as two options to decrease the nutrient density even further. Now looking at a typical close-up diet in the two systems, again, a close-up diet with corn silage, wheat straw, corn gluten feed, soybean hulls, wheat middlings, soybean meal, canola meal, urea, and vitamins. The NRC would calculate that diet to be 1.43 megacals per kilogram, whereas the NASEM system calculates it to be 1.61 megacals per kilogram. So the total intake of energy is about 2 megacals per day greater as calculated by the NASEM system. But again, we have the increased requirements to consider. Here again, the maintenance requirement is higher under the NASEM system. The pregnancy requirement is also considerably greater at this stage of late pregnancy. So the total net energy requirement under the NASEM system is 5 megacalories greater than in the NRC system. Again, the balances are strongly positive under the NRC system, but about equal or about in balance under the NASEM system. The NASEM system calculates that the metabolizable protein balance is slightly negative for this diet, indicating that the diet needs more protein. So just to summarize these energy changes in the NASEM 2021 publication, the energy requirements are about 17 to 18 megacals per day for dry cows and about 19 to 20 megacals per day for close-up cows, considering mature Holsteins. Diets will be higher in calculated energy with NASEM 2021 than NRC 2001, but the requirements are also higher in the NASEM system. The balances will be lower with NASEM 2021, and I think they're closer to what we see in the field, so that the system should do a better job in predicting. The NASEM system also has equation to predict dry matter intake during the dry period, and it takes into account the day relative to calving, the cow's body weight, and the NDF content of the diet. What we have plotted here are dry matter intake estimates for a diet with 30% NDF in the blue line, 42% NDF in the red line, or 55% NDF in the green line. And you can see that predicted dry matter intake as a percentage of body weight is lower as we increase dietary fiber, which I think should be logical in terms of its filling effect for the cows. Note also that the intakes for all three diets start to drop off between 2 and 3 weeks before expected calving, and end up at the same ending body weight in the week before calving. The black dotted line shows a prediction by NRC 2001, which only predicted based on body weight and not the energy concentration of the diet. Cows can consume enough energy from a variety of different diets to meet the requirements. And what I've done is shown several energy densities calculated by NASM 2021, and the dry matter intake then that would be necessary to supply 19 megacalories, which was about the requirement for net energy in the close-up period. And you can see even with a very low energy diet, the high straw diet, we need only 12 kilograms of dry matter intake to meet the energy requirement. Whereas as we increase energy density, we need even less dry matter intake to meet those requirements. The problem is that dry cows will not stop eating once they have eaten enough energy. Their intake is going to depend on rumen NDF fill and other chemostatic factors rather than being able to sense the exact energy intake. So it's very easy for cows consuming higher energy diets to overconsume energy relative to their requirements. That's shown in this table here. Again, the energy density of diets in the left-hand column, the corresponding NDF content of the diet, and a predicted dry matter intake for the cows. The far right column shows the net energy intake at those predicted dry matter intakes. And again, you can see that when we're in the green range here, the net energy intake is about where we want it relative to the requirements. But if we go too high in energy, the cows will consume more energy than they require, which can lead to health problems around the time of calving. So again, we need dry matter intake to provide the energy and the nutrients needed by the cow and calf. We want to keep that rumen full and healthy so that the cow is satiated. And if we're doing that, why would attempting to further increase dry matter intake be helpful? There's a lot of emphasis still put in the field on maximizing dry matter intake during the close-up period. And I think that's a bit misguided. We need to focus on the nutrient intake or the energy intake by the cow, which of course is a product of the nutrient concentration or energy concentration in the dry matter multiplied by the dry matter intake. Now switching to some consideration of metabolizable protein and amino acid nutrition for dairy cows during the transition period. In addition to energy balance being negative in cows, the metabolizable protein balance is also negative for the first 2 to 4 weeks after calving. This is a plot of some data from Cornell University showing that metabolizable protein balance is negative after calving and reaches its nadir about 1 week after calving, and then starts to recover, but doesn't fully come into balance until between the 3rd and 4th week of lactation. Some data from Tom Overton's PhD thesis with me years ago, we looked at the ratio of 3-methylhistidine in blood to creatinine as an indicator of muscle protein mobilization. Notice that at around 1 day after parturition, we're already having a large increase in protein mobilization that peaks at about the first week of lactation and then comes down to a new plateau. So cows are having to mobilize body protein reserves. Most abundant of those would be the skeletal muscle in order to make up that deficit of dietary metabolizable protein supply. Protein mobilization that happens before calving actually can contribute to ketosis and other health problems. We know that from data like these that protein mobilization can occur before calving. You can see the error bars here indicating that some cows were mobilizing large amounts of protein as indicated by the 3-methylhistidine concentration again. If we mobilize protein before calving, then there's less available to mobilize during early lactation, which is the critical time that we need to supply that protein. And if the cow is running out of available protein to mobilize, that may be a factor that leads to development of ketosis. First lactation cows require additional metabolizable protein during the dry period for growth. This is a meta-analysis from Jose Santos's group at the University of Florida and shows the fat-corrected milk yield as a function of prepartum dietary metabolizable protein. And over the range of protein intakes in the studies that were included in the analysis, the metabolizable protein ranged from about 500 grams per day up to a maximum of 1,100 grams per day. And you can see that overall the effect was linear up to the requirement of about 11% metabolizable protein, which could be supplied by 14.5 to 15% crude protein in most diets. In older cows, increasing prepartum dietary metabolizable protein had no effect on fat-corrected milk yield. The calculated requirement is slightly over 900 grams per day, according to NASEM. At the 11% metabolizable protein, if we feed the same diet as we're feeding to the heifers, to the mature cows, you can see we're probably overfeeding metabolizable protein. There was a linear metabolizable protein intake effect on protein yield for the highest producing cows that were milking greater than 36 kilos a day, but otherwise very little demonstrable effect of increasing prepartum metabolizable protein in older cows. So to summarize, according to the new NASEM model, the far-off dry cow and heifer, an 11% crude protein diet would approximately meet the requirement. However, the NASEM committee recommends 12% crude protein because of the limited data at those lower protein levels and potentially developing a limitation in rumen degradable protein. This level of crude protein would translate to 864 to 1,008 grams per day of metabolizable protein. For the close-up cow and heifer, 13% crude protein will meet the requirement. That translates to 936 to 1,014 grams per day of metabolizable protein, depending on dry matter intake. As we discussed, this might not be optimum for heifers, so that we may need to increase the metabolizable protein supply. Typical recommendations are that we try to supply 1,200 to 1,300 grams per day of metabolizable protein to the pre-calving cows and heifers. Now, it's important to point out that the NASEM model ignores metabolizable protein that's required for colostrum synthesis, for mammary development, for immune function, and for restoration of body protein supplies. And this is because there's just no data on which to model these effects for the NASEM system. So these places where we're not accounting for protein needs probably help justify why our field recommendations of 12 to 1,300 grams of metabolizable protein are greater than what the NASEM system calculates. The NASEM system also calculates an amino acid supply, an estimated amino acid supply. And the amino acid supply predicted for the close-up diet that I showed you previously is shown here. We're particularly concerned with lysine and methionine as the first two limiting amino acids. And you can see the ratio here is about 3.44 to 1, lysine to methionine. The targets, there's no requirement set by the NASEM system, but if we look at field used targets developed by people like Patrick French, who's a nutritionist here in the United States, lysine requirement of 90 grams per day, methionine of 31 grams per day or more. So a lysine to methionine ratio of 2.9 or even slightly lower to 1. So this diet would likely benefit from some rumen-protected methionine supplementation. Methionine is an interesting amino acid. I've shown you here the relationships between methionine and other components such as cysteine, choline, and the various intermediates involved in these interconversions. Part of the folate cycle also important here in relationship with methionine. So we typically think of methionine as being important for milk protein, and also cysteine would be needed for milk protein. But we need methionine also as a methyl donor for synthesis of many compounds throughout the body, including phosphatidylcholine, which is formed by methylation of phosphatidylethanolamine. Phosphatidylcholine, among other uses such as membrane function, is needed for very low density lipoprotein export from the liver, the means by which liver fat is exported. Methionine is also converted into glutathione, the most important cell antioxidant. So methionine has antioxidant effects. And finally, it's involved in providing the methyl group for DNA methylation, which is an important mechanism of gene expression regulation. So many different functions beyond just the synthesis of milk protein. We've conducted several experiments now looking at methionine supplementation during the transition period. This was the first study that we conducted in which we fed 3 diets, a control non-supplemented diet, or 2 different forms of supplemental methionine, either a methionine analog, Metasmart, or protected methionine and SmartAmine. These were fed during the close-up dry period and also on into the fresh cow period. Looking at some of the results from this experiment, dry matter intake during the dry period or the close-up dry period was not significantly affected by methionine. However, in the fresh cow period, methionine from either source stimulated dry matter intake compared to the non-supplemented controls. These are the production data with the p-value here shown for the effect of methionine. Again, either methionine supplement versus the control. Milk yield was significantly increased by methionine. Milk fat percent was not significantly affected across the treatments, but milk protein percent, milk fat yield, milk protein yield, and energy-corrected milk yield were all increased by either of the methionine supplements. We looked at the effect of the methionine sources on neutrophil phagocytosis as an indicator of innate immunity function in the cows across the transition period. And at 21 days of lactation, the methionine sources in the transition diets significantly improved the degree of neutrophil phagocytosis compared with the control cows. Some markers of metabolism and inflammation, oxidative stress are shown here. Carnitine concentration in liver was increased by either methionine source. Albumin was not affected. Ceruloplasmin and serum amyloid A, the two acute phase proteins, were both lower in the methionine supplemented groups, again indicating some anti-inflammatory effect of methionine, perhaps through glutathione. Oxidative stress, shown here, the capacity for absorbing oxygen radicals was greater in the methionine supplemented cows, and the glutathione concentration was also greater in the methionine supplemented cows. So a wide variety of effects of methionine during the transition that we have confirmed in subsequent experiments. Well, what about lysine as the other major limiting amino acid? My colleague Phil Cardoso conducted an experiment that looked at lysine supplementation as rumen-protected lysine. When they supplemented it prepartum, they had improved dry matter intake postpartum, showing that lysine has some beneficial effects here on dry matter intake. That translated into improvements in energy-corrected milk yield and fat-corrected milk yield. Also, the yields of fat, protein, and casein all were significantly improved by pre-calving supplementation of lysine compared with the pre-calving controls that were not supplemented. All right, so we've shown that protein and amino acids are important during the transition. Let's turn now to calcium and hypocalcemia. This is a very interesting experiment from Jessica McCart at Cornell University in New York. They looked at two large commercial herds and followed the calcium concentrations across the calving transition. So these are two separate herds showing total blood calcium. Let's just focus on the bottom herd because the differences are a little easier to see. In analyzing these several hundred cows' data, McCart was able to pull apart 4 different patterns of calcemia or calcium in the blood across the transition. First, there was normal calcium, where the calcium concentration decreased here in the black curve, and then rebounded fairly quickly to the same level as before calving. The second group was transient hypocalcemia, where in the reddish brown line here, the cows decreased further after parturition, but then rebounded quickly again to the same level as pre-calving. The third group was a persistent hypocalcemia, and that's shown in the green line, where cows decreased at calving and stayed persistently depressed out through 10 days of lactation. And finally, a delayed hypocalcemia that is in the green curve is a delayed hypocalcemia, where it stays low after parturition. The purple curve here is actually the persistent, where they drop sharply at calving and then stay lower for the duration of the 10-day period. Sorry for the mix-up there. The differences here actually translated into some interesting production and disease results. So the normal calcemia cows produced actually less milk than the transient subclinical hypocalcemia group, indicating that this normal or that the drop in calcium in cows that were able to recover it may be a normal part of adaptation in high producing cows. The persistent subclinical hypocalcemia was about the same as the controls, but the delayed hypocalcemia actually produced less milk than the normal calcium. The degree of hyperketonemia was greater in cows that had subclinical hypocalcemia of any sort. Metritis was increased in the persistent and delayed hypocalcemia. Displaced abomasum also was greater for those two groups. Removal from the herd was increased sharply for the delayed hypocalcemia group, and the occurrence of any adverse event was greater when there was hypocalcemia present, but was most detrimental, or the most occurrences here of adverse events for the persistent and delayed subclinical hypocalcemia. So this shows that hypocalcemia is not all the same, that there are different patterns that may have different outcomes in terms of herd survival and productive ability. The controlled energy diet approach during the dry period results in greater blood calcium at calving. As shown here, the green is the controlled energy diet. The blue is the high energy restricted fed cows, and the red is the overfed that dropped the sharpest in blood calcium concentration at the day after calving before rebounding. So the controlled energy approach seems to also have beneficial effects on calcium status, although we don't understand the mechanisms as of yet. So one of the important developments over the last 30 years or so has been the anionic diet, or the negative DCAD diet. This works by developing metabolic acidosis in the cows, which increases urinary calcium excretion and stimulates parathyroid hormone release. So if we have low blood calcium, there are three responses in the cow. Low blood calcium signals release of parathyroid hormone, which signals the kidney to conserve calcium and also to increase the hydroxylation of 25-hydroxyvitamin D into 1,25-dihydroxyvitamin D, the active hormonal form. A second function occurs at the increase in calcium that's excreted by the kidney is about 6 to 12 grams per day. The second area that is affected by low calcium is the intestine, and PTH, through activation of the vitamin D, signals the increase in calcium absorption from the small intestine. The third site of action is the bone, and PTH and 1,25-dihydroxyvitamin D work in concert to stimulate resorption of calcium from the bone. So by metabolic acidosis, stimulating these effects before calving, we're stimulating the mechanisms by which the cow can maintain calcium homeostasis and enable the cow to restore the normal calcium concentration soon after calving. However, when we have conditions that prevent the activation of PTH, we get a sluggish or no response to the system, and that leads to development of hypocalcemia after calving. In another meta-analysis by Jose Santos' group, they showed that the risk of milk fever was lowest when urine pH, which decreases with a negative DCAD diet, when the decrease of rumen pH or urine pH was the lowest, the risk of milk fever occurrence was the lowest. Alkaline diets that are produced when we don't add negative anions will greatly increase the risk of milk fever. The negative DCAD diets also improve milk yield in older cows, but not in first lactation heifers, and stimulate dry matter intake in both older cows and first calving heifers. So as we go to a more negative DCAD, we have improved intake in both cows and heifers and improved milk yield in older cows. This was an experiment done at Cornell University to look at partial acidification. So adding some negative anions, but not fully acidifying the cows to a negative DCAD of the minus 7.4 here. So 3 treatments, an untreated control group, a partial acidification with a DCAD of 5.9, or a full acidification with a DCAD of minus 7.4. The urinary calcium excretion was increased for the low group, the fully acidified group, but not the other groups. Dry matter intake pre-calving was slightly greater for the partially acidified group, but differences were small. The dry matter intake in the first 3 weeks postpartum increased linearly with increasing acidification or a more negative DCAD. And milk yield also increased linearly in response to increasing acidification, showing that the greatest benefits are going to be seen with a full acidification to decrease the urine pH to 6 or below. We conducted an experiment to look at calcium inclusion in a negative DCAD diet and showed that milk production was greatest when the calcium was high at 1.5 to 2% of dry matter with a negative DCAD diet compared with lower calcium in the same negative DCAD diet. Here are the dietary macro mineral concentrations that were published in the NASM guidelines compared with the NRC of 2001. The calcium requirement actually decreased slightly. Phosphorus also about the same, magnesium about the same, potassium a slight increase, sodium a slight increase, chloride about the same as NRC, and sulfate about the same. In the right-hand column are my recommendations for use with a full anionic program, also with a 1.2 times safety factor, so that we are going to meet the requirements of nearly all the cows in a group. You can see high dietary calcium, fairly low dietary phosphorus, high dietary magnesium, very important to minimize hypocalcemia and other problems. Potassium, we try to get as low as possible. Sodium at about 0.19% of dry matter. Chloride will be higher depending on how much negative anions we have to add to the diet to get proper acidification. And sulfate may also increase then with sulfate salts added to decrease the DCAD. Trace mineral concentrations, the same setup here. The NRC value compared with the new NASM value and my recommendations, which include the 20% safety factor. So cobalt was nearly doubled in the newest NASM requirements. Copper was increased because maintenance requirements for copper are increased. Actually, in lactation, the requirements are decreased, however, compared with NRC 2001. Iodine, a slight increase. Iron, basically no change. Manganese was more than doubled. Selenium unchanged, and zinc increased by over 50%, or about 50%. So these show the changes in the new requirements by the NASM publication. All right, finally, in the last few minutes here, I want to talk about feeding the fresh cow group. This is probably where the least is known about the proper nutrition, and so the greatest opportunity for research to help to improve the system. Still a lot to learn in fresh cow nutrition, but two very important principles are to maintain rumen health in terms of NDF supply and physical form, and to push metabolizable lysine and starch concentrations while controlling the fermentability of the starch, because overly fermentable starch may actually suppress dry matter intake. The fresh cow diet, an optimal dry period diet will dilute the lactation diet ingredients with straw or other low energy ingredients. So we provide some maintenance of rumen adaptation to the lactation ingredients. Straw leaves the rumen very slowly, so we have some auto adaptation when the lactation ration is introduced after calving. And in some cases, we like to include a small amount of chopped straw to the fresh cow or lactation group where the effective fiber is marginal or limiting. Diet physical form and effective fiber size is likely as critical as chemical formulation. And of course, there's some controversy over how we characterize effective fiber. Overcrowding in fresh pens will increase risk of slug feeding and acidosis, causing cows to develop high NEFA concentrations and low dry matter intake. And cows should be moved from the fresh cow diet if we're feeding a separate group when they're healthy and have good rumen fill, particularly when we're feeding a lower energy fresh diet. We need to move those cows onto the higher nutrient density lactation diet as quickly as they're able to be moved. Formulating for lower dry matter intake than the lactation groups, so 18 kilograms versus 25 kilograms is an example. Rumen health and function is key. We want to maintain forage NDF at 22% of the dry matter intake or greater. Optimizing starch fermentation rates. My field experiences tell me that the hepatic oxidation theory from Mike Allen is correct relating to intake control, so that highly fermentable starch causes propionate to get to the rumen get to the liver very quickly and triggers a signal to shut off intake. Finally, pushing microbial proteins formation, doing everything we can to keep the rumen healthy and producing microbial protein, and watching RUP for increasing the total metabolizable protein supply. There's an interesting experiment from the Miner Institute in New York that looked at 3 different dietary combinations for cows that were fed a controlled energy diet prepartum. The dietary treatments were low, so cows fed a low starch diet for the first 13 weeks of lactation, the low starch being 21% of the dry matter. The second group was a medium high, where they were fed a medium starch diet of 23% for the first 3 weeks, and then a high starch diet of 25.5% for the next 10 weeks. And the final dietary group was the high starch diet, 25.5% fed through the first 13 weeks of lactation. Note that dry matter intake decreases as we go to the higher starch density. However, this experiment is confounded by reduction in dietary NDF. The ingredients that were used to adjust the starch content were lower in NDF. So we have a lower NDF, which may have contributed to the suboptimal rumen conditions that resulted in lower dry matter intake. Milk production was maximized by the medium-high treatment in this experiment, and actually lowest for the high, where they were fed the high starch all the way through. Another experiment looking at starch content from the University of Alberta in Canada. In this experiment, there were 4 treatments that were combinations of pre and post-calving starch. So the first group was pre-calving 14% starch, post-calving 25% starch. The second group was pre-calving 14%, post-calving 33% starch. Third treatment, 26% pre-calving starch and 25% post-calving. And the final treatment, 26% prepartum starch and 33% postpartum starch. There was no difference in dry matter intake across those 4 groups, despite the fact that we have a very high starch content of 33%. Milk production was greatest for the pre-calving 14% and post-calving 33%, and the other 2 groups were not different from the pre-calving 14%, 25% postpartum group. The milk fat concentrations were greater for the higher prepartum starch groups, and an interaction for the milk protein that followed the similar pattern to the milk production. In this experiment, they substituted dry ground corn for soybean hulls to make the difference in the starch contents while keeping the forage NDF equal. So a different philosophy of diet formulation than the previous experiment I showed you. It's also important to note that these cows were offered 3 kilograms per day of grass hay for the first 3 days after calving, which may have helped buffer the rumen for the changeover to that very high 33% post-calving starch. So an interesting experiment perhaps tells us that we don't need to be as concerned about going to high total dietary starch if we're maintaining our rumen function and rumen NDF intake. So with that, my comments are completed. Thank you for your attention, and I'll be glad to try to answer some questions.
Okay, thank you, Professor Dreckley, for such a comprehensive research and insightful presentation. Now let's move on to the next part of the discussion. We have 20 minutes for this discussion session. We'll now open the floor for the question from our audience. Please, you can type your question in the chat box and I'll ensure they are addressed to Professor Dreckley. Or you can ask personally to Professor Dreckley by using raise hand features on your Zoom toolbar.
Yes.
Okay, thank you so much, Professor Dreckley, for such clear, informative presentation. Your insights on managing energy intake during the dry periods and preventing common issues like ketosis and hypocalcemia were really helpful. One point that really stood out to me was the concept of control energy diets during the dry periods and their impact on reducing metabolic disorders such as ketosis and displaced abomasum. And the other part that also caught my attention was the Goldilocks approach, making sure energy intake is not too much, not too little, but just right. To start the discussion while we wait for the audience question, maybe I would like to ask that you emphasize the importance of controlling energy intake during the dry periods. How do you balance this with ensuring cows meet their metabolizable protein needs, particularly when using bulky, low energy forages like wheat straw? Professor Dreckley, we would love to hear your thoughts on this.
I'm sorry, could you repeat the question one more time?
Okay. You emphasize the importance of controlling energy intake during the dry period, right? How do you balance this with ensuring cows meet their metabolizable protein needs, particularly when using bulky, low energy forages like wheat straw?
Yes. So the metabolism with the controlled energy diet, we usually see lower beta hydroxybutyrate, so lower ketone bodies, lower non-esterified fatty acids in the blood, so indicating less adipose tissue mobilization. And if we look at the liver, less fat infiltration in the liver in those cows. So it seems to be changing the metabolism of the cow relative to too much energy coming from starch.
Okay, thank you, Professor Trackley. That's a great point. I think it's really interesting to think about how small changes in diet can make such a big difference. Okay, let's turn it over to the audience now. If you have any question or need clarification on anything, feel free to unmute or drop your question in the chat box. Uh, okay, I think we have one question here from the Nashwa Kirana. For your question about one of the slide mentioned that excessive heat causes liver inflammation in dry cows. What is the relationship between excess heat and liver inflammation? Professor
Yeah.
Dreckley, would you like to respond this?
Yes, that's a very important and very interesting question. I can't answer it definitively. We don't know exactly the mechanism that is leading to the greater inflammation. One possibility is that we're controlling or decreasing the amount of starch in the rumen, and so perhaps we're decreasing the inflammatory substances that are coming in from the rumen um, during the dry period and triggering inflammation in that way. So things like lipopolysaccharide from rumen microorganisms that might be greater in the higher grain diet could be a triggering factor, but we really don't know what's causing the inflammation. Just that in several experiments now we've shown them to be more inflammatory in the liver.
Okay, thank you, Dr. Trackley, for the detailed explanation. And we have one small question here in the chat box from Dr. Amy. The question is how to deal with the cows whose feed intake is lacking? Could
Yeah,
you
that's
please?
an important question. Typically, we can, if we're formulating diets properly, the cows will be ready to eat that diet, and the cows that are lacking in intake usually have some sort of problem, either subclinical or clinical problem. So the answer, I guess, is to try to find the underlying cause for why those cows are lacking dry matter intake.
Okay, thank you so much, Professor Trackley, for the clear explanation. While we wait for more question, maybe I have another one question, if you don't mind, Professor.
Sure.
Uh, Professor Trackley, could you expand on how transition diets influence reproductive success? For example, how do the dietary adjustment during the dry and early lactation periods affect the reproductive parameters like conception rates or days open? Could you a little bit elaborate on that for us, Professor Trackley?
So the effects can be through a couple of ways. Um, Cows that go into an extreme negative energy balance, we know have more days open and a greater difficulty becoming pregnant. So if we're showing if we're slowing the degree of body fat mobilization, preventing that extreme body fat mobilization, keeping cows on feed better, we avoid that severe negative energy balance, and that follows through then to have better fertility and better reproductive success. There are also some data looking at direct effects of non-esterified fatty acids or ketones on the follicle and more direct mechanistic effects, which also, if we're decreasing NEFA mobilization and ketone formation, that we should have positive effects on reproduction as well.
Okay. Thank you, Dr. Trackley, for explaining the interplay between the transition nutrition and also the reproductive outcome. I'm sure this will encourage our audience to reevaluate their practices. And one small question that directly sends to me here, the question is, how can smaller scale dairy farms with limited resources implemented some of the advanced strategies that you have discussed today? I think
Yeah.
that's the question.
Yeah, so small farms, it's going to be difficult to have all these groups, obviously. So one thing for smaller herds, if they're using a TMR system, we can use just a one diet dry cow approach, where the diet is formulated to be kind of in between the far off and close up ideas. And that way there's just one TMR mixed for the smaller number of dry cows. If we go to a really small farm that's not using TMR, we just have to try to whether we're feeding individually or feeding just a handful of cows, trying to, again, avoid overfeeding corn silage in particular during the dry period, and focus on trying to meet the requirements of the cows without excessive either corn silage or grain supplementation during the dry period.
Okay, thank you very much, Dr. Trackley. This recommendation of a realistic solution that many farmers can start applying right away. Okay, Dr. Trackley, I thank you for your thoughtful answers. Does anyone have any follow-up question or additional thoughts on this topic? Maybe feel free to raise your hands or type them in the Zoom chat. Okay, I think it seems no question against here. Thank you once again, Dr. Trackley, for the detailed explanation. It's great to hear practical insight that can be implemented in the real world scenarios. Maybe I think I personally want to open more question here, but the time is very limited now. So with that, I would like to thanks Professor Trackley for the very fruitful lectures today. We learned that a strategic focus on controlled energy diets and also metabolizable protein during the transition periods can significantly improve cow health and productivity. The emphasis on avoiding overfeeding and also meet precise nutrients need was particularly impactful. So once again, thank you, Professor Trackley. We are really appreciate that on behalf of everyone here. Thank you, Professor Trackley, for sharing wealth of knowledge. We deeply appreciate your time and insights. This concludes our session for today. Thank you for your active participation. And also, please stay connected for our upcoming guest lecture and feel free to reach out with the further question maybe. With that, we come to the end of